Today we're going to talk about role clarity and boundaries as a residential counselor. Odds are the core part of your job as a residential counselor, or whatever your specific job title is, has to do with implementing the basic structures of your program. There's going to be times for recreation and chores and meals and bedtimes and transitions between these activities. You're going to have a behavior management system that your whole program tries to use consistently. So a basic part of your job is implementing those basic structures and doing it in a fashion that maximizes physical and psychological safety. Unless students, clients feel safe, you cannot expect them to have a transformational experience. That's the foundation upon which change happens. So let's talk about the counselor part of residential counseling. Right? And this is my own definition, but I think it can be helpful to understand the distinction between counseling and therapy. So counseling is primarily concerned with helping clients be successful in the moment. And a huge way that this is done is by helping your clients improve their ability to self-regulate. And really, to self-regulate one's behaviors, you have to be able to regulate your own feelings and your own thoughts. So, combined with the ability to make plans and have goals, these are called executive skills. And they'll be covered in more detail in future trainings. You're also going to focus on social skills and coping skills and peer relationships. But in general, you're focusing as a residential counselor on the reasons why your client is getting treatment in a residential setting instead of getting treatment in a community-based setting. Right? Therapy has broader concerns. Like I said, there's a huge overlap, but the main focus of direct care staff of residential counseling is to focus on those issues, those behaviors, feelings, thoughts, patterns that are why the student, the client, is getting treatment residentially instead of in the community. Boundaries are oftentimes a really tricky area as a residential counselor. And I'll tell you, in decades of experience, boundary violation problems are the main reason why people lose their employment. So one reason why it's really tricky is because as a residential counselor, there are probably what I call necessary boundary violations that you have to do. You might have to do room searches or personal searches. You might have to see your clients in their pajamas. You might have to do hygiene checks to make sure they're using shampoo. You probably will have to monitor conversations among clients. You may have to do physical restraints depending on the setting you're in. The category of necessary boundary violations will be different in different settings, maybe different based on the age of clients, sometimes for what feels like a boundary violation. Short-term versus long-term treatment can be different. But part of doing residential care involves these boundary violations, and odds are you're going to be working with some clients who part of why they're not thriving in the first place is because adults have inappropriately violated their boundaries. So because you have to do some of these pushing of boundaries, you want to be really clear in 5 areas that truly are boundary violations as a helping professional. Right? So the first area is physical boundaries. How close to stand to or sit next to someone? Are doors opened or closed, all the different manners of touch, right? High fives, fist bumps, side hugs, back rubs, piggyback rides, pats on the back, occupational therapy interventions like joint compression. You want to be consistent with your agency's policies and practices. Personal presentation boundaries is the second area, right? That has to do with appearance and speech. You need to dress for the tasks that you're being asked to do, and that could involve all sorts of recreational activities. But you shouldn't be wearing ripped clothing. You want to dress like a professional given the context of the tasks. You should not be swearing. You should really be thoughtful about the language you're using, because odds are you're trying to teach your clients to think before they speak. And part of your job is to model that. Third area, personal disclosure boundaries, right? This is the most common one that results in people losing their employment. Your own personal family issues, romantic relationships, drug use history, sexuality, all that sort of stuff, you should not be sharing with clients. I've worked in some settings, in drug alcohol treatment setting, where some staff are specifically trained in the use of self-disclosure, but in the vast majority of situations, that's not going to be part of the program that you're working within. And personal disclosure boundary violations happen for the best of intentions, right? You're trying to form a rapport, make a connection with this client. But even if it goes well, the game of operator kicks in, and that client tells another client, and that client tells another client, and it starts to get twisted and to change. And before you know it, your self-disclosure that was your personal disclosure that was made for with the best of intentions is now making some clients feel psychologically unsafe. Fourth area, contact boundaries. Your agency probably has policies about this, which you need to know, but contacting students or clients through social media, using your personal cell phone or personal email accounts or text messaging, Instagram, all that sort of stuff. Your relationship with your clients is a professional one. It's in the context of your employment and happens through your employer. And finally, fifth area of boundary violations is role boundary violations. You are almost certainly providing treatment as a member of a larger team. There may be nurses, clinicians, teachers, administrators, parents, maybe judges. There's these other adults that are involved in the student or client's treatment experience. So you should not be sharing your personal opinions in areas that really are someone else on the team's, more concern. Easy example, you might have an opinion on a client's medications, but you're not the prescriber, you're a residential counselor, so you should be staying in that lane. And finally, talk real briefly about secrets and confidences. So this has to do with almost boundaries in the other direction. The client wants to disclose something to you, but, you got to keep this secret. You can't tell anyone. Do not make that promise, right? You're part of a team. Instead, make clear to your client that they should not tell you anything sensitive unless they trust your judgment. Look, there may be some things that you don't need to share with other people on the team, but you can't promise that ahead of time, right? And in my experience, when you slow down a client making a disclosure and you explain why, you actually increase the client's trust in you. almost always the disclosure still happens. In my decades of experience, there have been a handful of times where the disclosure ends up happening an hour later or the next day or maybe a week later. But do not promise to keep secrets or confidences when you're a member of a treatment team. All right, that's it. I hope this was really helpful, and I'll see you at the next orientation training. All right, bye-bye.